Good afternoon, everyone. This is Nancy Alvaron, Superintendent, and I have with me Deputy Superintendent Stephen McMahon. I want to welcome you and thank you for taking time from your busy day to access the information we're about to provide. I hope everyone is well and staying healthy and helping our community curtail the spread of this terrible disease. I also want to thank you for your patience, your flexibility, and adaptability given today's regularly changing environment. We recognize how hard this has been, particularly for our students and families. Those of us here, in addition to being educators and working in this sector and having a lot of training, we're also parents, so have a tremendous amount of empathy for our parents and families, because we too have experienced many of those feelings that you have at home. Me personally, from frustration with not being able to understand a distance learning lesson my child has accessed, or just elation because my student knew a concept that I didn't think he knew. So just want to thank you for being there for your child, for supporting them, and for continuing to access information with us. So I want to let you know that we're thankful to the legislature and the governor. As of Monday, like 2 days ago, we have now been given more specific guidance regarding how to move forward with opening schools in the fall. Yesterday at 3:30, the Santa Clara County Public Health Department, in collaboration with the County Office of Education, released the guidance for safely reopening schools. And this is different than the health order that may be posted on their website. This is specific guidance for schools. So our agenda today will be to give you more information on the guidance we received from the state through the budget bill that was passed on Monday. Then a brief overview or information about the Santa Clara County Public Health guidance for schools. Talk a little bit about the reopening plans that we sent you, or the letter that we sent you earlier in the week. And then we're going to spend the bulk of the time fielding questions and responding to those questions. I want to preface the question and answer part with an apology in advance. There will be some questions we can answer, but given that we just received better direction at Monday and Tuesday, there'll be a lot of questions that we won't be able to respond to today, but know that we are committed to working quickly and diligently to get the responses to those questions as quickly as possible. So with that, I'm going to turn it over to Deputy Superintendent Stephen McMahon.
Good afternoon, everyone. As the superintendent mentioned, we're going to talk about the budget. This sentence is kind of the overarching statement of California's budget and accompanying language for public schools for next school year. This is new education code. You can look up this number. It's part of the 2020-2021 package of laws in response to COVID-19. A local educational agency, in our case, the San Jose Unified School District, shall offer in-person instruction to the greatest extent possible. So the education code has been updated to make sure we offer in-person to the greatest extent possible. Underneath this overarching statement are a lot of details. We have to provide 180 days of instruction. So the school year remains the same as it always has been. We have to provide a minimum school day, 4 hours at the high school level, down to 3.8 hours at the elementary level. That's instructional time. So that doesn't count things like recess or lunch. Attendance continues to be mandatory. And the instructional part of the day needs to be with a credentialed teacher. So we picked this one statement for everyone to just get an understanding. California is preserving funding for its schools with an expectation that in-person instruction be offered to the greatest extent possible. Attendance is required, a full school year is required, and a daily number of minutes will also be required. Locally, the County Health Department released guidelines for school yesterday. So yesterday afternoon, they shared this with the school districts. It's on their website. you want to read it. Their guidance is designed to assist in the planning for the safer reopening of schools. So the state budget requires the opening of schools. The county health department also has written guidance for the reopening of schools. So everything is moving in the direction of schools reopening in August. Related to the health guidance, the American Association of Pediatricians also released their guidance saying that schools should open in person as much as possible for students. So pediatricians are also advising that we provide the in-person experience as much as possible. There's a lot of specifics in the county health guidelines, but some of the restrictions we thought would be there are not. There is no cap on group size. There's an effort to keep groups as stable as possible. And then face masks are going to be an expectation and requirement, especially for our older students. Face masks are complicated because not all of our students can wear them all day for health and safety reasons. So there's no group size cap. There's an expectation that we wear face masks throughout the day. But the county health department has not issued any rules that would stop us from opening the schools in the fall. So when we put together the state budget and the county health guidelines, we're moving forward with a plan that is as flexible as possible. We build our school schedules, we assign students to teachers, and we add technology to the classrooms that allows the instruction and the other students to be accessible from home. We don't know how many students will be at school in August. What we don't want to do is have a plan where we have to rebuild it if the situation changes. Today, California budget, in-person instruction to the greatest extent possible. County health orders, no caps on the group size. We understand that many families will not want to send their students to school. We're trying to maintain that flexibility by having the instruction be available online. We do not have the resources to build two school systems. So we don't have the ability to build an at-home system with a certain subset of teachers and an in-school system with a different subset of teachers. That also doesn't fit with the legislative intent of offer in-person as much as possible. We want to provide that in-person experience to the greatest extent possible with the ability to flex it to an at-home model without rebuilding it from the beginning. This is not going to be easy. Instruction will not be the same. There's a lot of challenges within this system. We hope everyone on this call can accept nothing's going to be normal in the fall. So we're still responding to a pandemic. Nothing's going to be normal. School will not be normal. Our social interactions will not be normal. We're going to do the best we can with the situation we have and implement the guidance of the state, implement the county health orders, and provide families as much flexibility as possible. If they need to stay home for family circumstances, we're going to give them the instruction. If you do take the time to read the new education code language, there's multiple citations of daily instruction to maintain school connectedness. There's a desire that students are able to connect with their peers even if they have to be at home, and they're able to connect with their teachers even if they have to be at home. So that's the model we're going with. To put this all together and what it means for parents, schools will be open in the fall. Attendance at school will be mandatory. That's not a San Jose Unified School District decision. That's a state of California decision. One of the lines in the new education code says compulsory attendance is not waived for the 2020-2021 school year. So the state is telling everyone you need to attend school. We're trying to provide a model where that attendance could be at home or in person. So we don't want to mark students absent who can't come to school for legitimate reasons. If you attend the classes online, it'll count as attendance. One of the hardest parts is going to be maintaining this flexibility. Given the many unknowns with this virus, we anticipate some students will need to come in and out of school in unpredictable ways. We want a system that is as flexible as possible to accommodate that. So if you're a parent, you can know that schools will be available to your children in August. The state of California is going to want you to send your students to school. Sending your student to school in Santa's unified model could be at home or in person. That at home, in-person mix will be flexible because circumstances are going to change. So we committed to making sure we did the overview as quickly as possible. If you've logged into the Webex, there's a Q&A screen. We've already got dozens of questions in the Q&A screen. We're going to try to group them into categories and respond by the category so we can get to more questions than if we do them one by one. We'll answer questions as much as possible, but sometimes we can only provide a response and not an answer. There are still things that are unknown that we have to work through and finalize for the fall. So the first main theme is, as an individual parent, can you choose to stay home? What Santa's Unified is proposing is that if your individual family circumstances mean you need to stay home, you'll be able to stay home and access the content online. We are going to work with families that decision doesn't change every day or every week or every month. We're going to want some system where it's stable. That fits with the county health guidelines that the groups stay as stable as possible. So ins and outs are hard to manage and they don't fit the county health guidelines. In and outs may occur due to medical needs. So a family member is exposed to the virus, the student may need to stay home for 14 days, even if they're symptom-free, even if they test negative for the virus. County health may want them to stay at home anyways, which means they'll access the content online for that 2-week period. And all of the rules for when a student needs to stay home are part of the county health guidelines. So if you go to the Department of Public Health, there's a PDF of the guidelines. It has sections on what to do if a student tests positive, if they have symptoms, or if there was an exposure concern. And then we'll implement and follow those guidelines. Next big question was, is there a limit to class size? When this was shared throughout the county, the first question to public health was that question, is there a limit on class size? The answer was no. If you look at the county health guidelines, there is no limit on the group size. There's a requirement that we keep the groups as stable as possible, so students can't switch their schedules. At the elementary level, that means the same teacher with the same peer group, stable. At the secondary level, it means the same course schedules and a stronger emphasis on face masks because there'll be more mixing of students at the secondary level than at the elementary level. Question about if the state requires masks, can the county have a softer requirement? When it comes to health orders, we've been operating on whatever the strictest guidance is the guidance we follow. So whether it's state guidance or county guidance, whichever one is stricter, we follow. All of the guidance recognizes that some populations can't wear a mask all day, that there has to be some acknowledgement that there are adults and that there are students who cannot wear a mask all day. In many cases, those are for different health conditions. But we have to implement the stricter guidance, and we will do that. Question about student privacy when we're live broadcasting. It's a concern we all share. Having classes online with a mix of students at home and a mix of students in person changes the level of privacy for sure. As a general statement, San Jose Unified believes nothing should happen in the classroom that someone shouldn't have been able to observe anyways. So there should be no behaviors or interactions between teachers and students or among students that someone shouldn't have been able to observe. We've had a long-standing policy that evaluations, observations, anyone can come into a classroom at any time as long as we know it's happening and observe. We're public schools, these are public spaces. As long as it's not disrupting the learning environment, nothing should happen that shouldn't be available publicly. If a student causes behaviors that are disruptive in the online environment, we're going to have to deal with those like we would in the in-person environment. Next big theme is, will only some students be allowed to attend in person? We do encourage everyone to read the health department guidelines. At this time, there are no restrictions on the size of the group. The restrictions for 12, for childcare or summer camps, those will not be in place in the fall unless County Health changes its guidance. As of yesterday, they're telling us there's no group size limit. So San Jose Unified doesn't have the authority to tell some families no. We're trying to maintain the flexibility that families, based on their circumstances, can access it online. Our ability to tell individual students you can't come to school will be based on health conditions. Exposure to COVID-19, confirmed case of COVID-19, or a new health order that limits the size. But as of yesterday, County Health is not putting a restriction on the group size. The questions about face shields versus mask. Under normal times, masks are worn to protect the wearer. So you get a certain level of mask based on your risk exposure. And the filters on those masks are designed for the environment you're working in. In response to COVID-19, it's completely switched. You wear a mask to protect others. Wearing a cloth mask doesn't protect you from inhaling the air. It's not a respirator. It doesn't have a filter. We are being asked to wear masks to protect others. So when you wear a mask, the number of droplets you introduce into the air decreases. So everyone wearing a mask is to protect others. Face shields, as County Health shared yesterday, are not that effective without masks with filters underneath. So if you wear a face shield with no other covering, you're not stopping airborne droplets. So what County Health said was, if you wear a face shield, it needs to have a drape that tucks into your shirt, or you need a mask underneath. So some people have jobs where a face shield is an additional protection for them because of other particles or droplets, and it's an additional protection. But County Health is requiring the face mask to stop airborne particles and to protect others. This is a question about new students. The transition to new grade levels is going to be one of the biggest challenges for our teaching staff and our support staff and our administrators. So students that have never been in middle school and are transitioning to sixth grade, much harder than students who are already at middle school. Students who are coming to transitional kindergarten or kindergarten for the first time, much more challenging. Just establishing the routines and the classroom norms is going to be much harder for a group that's new than a group that had gone through those experiences before. So we know that that's a challenge. We'll have to work with our employees on how to support that transition as much as possible. Question about funding for safely opening schools. The state of California is providing hand sanitizer, cloth masks, disposable masks, thermometers, and some other supplies. So we will have a good inventory of supplies for health and safety in the fall. In addition, the school district is ordering many more supplies. So we will have health and safety supplies for every staff member and every student in the fall. We're not receiving additional funding specific for those items, but the state is providing the initial shipment paid for by the state. The school districts will continue to support those supplies throughout the school year. There's a question about the legislative language to the greatest extent possible. In-person instruction to the greatest extent possible has language underneath it that says you can provide distance learning in response to a county or state health order or in response to the individual medical needs of the students. So the standard is in person. If for health reasons or health order reasons, you need to go to distance learning or online learning, you can do that. So a school district would need clear health conditions to tell a family you can't come to school. So we know that many other school districts have announced plans that restrict access to the schools. They are in the process of changing those because the state budget doesn't allow you to restrict access unless you have health guidance restricting the access. Then a unified model is designed where the access is available to families. The family decides they need to stay at home. We're going to try to provide the content online. Several questions about after-school care. We'll do the best we can to support students and families, but the number of before-school and after-school opportunities will be severely limited. County Health has told us they're going to provide guidelines for sports and other extracurriculars in a couple weeks. I think it's reasonable to anticipate right now that we're going to provide school in stable groups. Those students transitioning to after-school activities in different groups is going to be very limited. There will not be a lot of after-school events. There won't be assemblies. There won't be a lot of the things we have as part of our normal school day because we need to keep the groups stable. Do elementary students have to wear masks? Everyone needs to wear a mask as much as possible. That's the expectation, that's the standard. Some students will need to take the mask off for their own health reasons and their own safety reasons. So the expectation is that everyone wears a mask. We've talked to a lot of medical professionals. We've also spoken with pediatricians. We've consulted with psychologists. Asking a kindergartner to wear a mask all day is an unreasonable burden. They're going to play with the mask. They're going to take it off. They're going to want to exchange the mask with their friends. Kids are going to be kids. So we're going to work with our school nurses. We're going to work with our teachers on helping inform students why we want them to be safe. Wash your hands, wear your mask, don't share things with your friends. Those are all things that will be part of our school instruction. If we lose a teacher because they need to stay at home, we'll either have to get a backup teacher to cover that, or the teacher will provide the instruction remotely. That's part of the concept of being able to flex the model. Not only is it possible for students to stay home, it may be possible for teachers to stay home depending on the situation with the health order and who's at school and who's not. If large numbers of students are at school, then we'll need another teacher to cover for the teacher who's not there. Questions about volunteers and access to the schools. Like after-school activities, all severely limited. There will not be adult volunteers on campus. We won't have field trips. We will not have school-wide activities. We need to keep the groups stable, which means we can't have unknown adults coming in and out. Unknown meaning we don't know when they're coming and how long they're staying. So everything will be by appointment. If a parent needs to work with the school, we'll have to schedule a time so we know the parent's coming. We'll be able to prepare for it and work with that parent. We will not have parent volunteers in the classroom. We won't have parent volunteers supporting the school environment. Those are all things that would make implementing the health orders much harder for us. So one of the key things about the health orders is keeping the groups as stable as possible. Having volunteers coming in and out decreases the stability. Questions about technology. We've already placed orders to have a device for every student. So when we initially closed, it was devices for families. Going to this model, we understand every student will need a device. So we're ordering a significant number of devices to make sure we can get one to every student. We're focused on iPads in grades K through 3, Chromebooks in grades 4 through 12, mainly because a touchscreen is better for younger students. We need the keyboard for the older students. So we are ordering a device for every single student, not every family. Question about alternating time at school or school days. We've talked to the medical professionals about this. If a teacher is going to see 100% of their students over a 5-day period, there's no health advantage to bringing in half the kids 2 days a week. The virus often has a 5-day incubation period. Having half the students come on Monday, Tuesday, and half the students come on Thursday, Friday doesn't add any safety, because over the 5-day window, we've still had 100% of the students on campus with the teacher. That's why the county health orders don't restrict the size. There's not medical evidence to suggest that doing that adds a safety measure. Schools and testing. We will be doing symptom checking. We will not require every student to get a COVID-19 test, nor every staff member. Based on the results of the symptom checks, testing may be recommended. Self-isolation may be required whether there's a positive test or not. One of the challenges with this virus is a negative test doesn't mean the person doesn't have the virus. So you might see that some entities require multiple tests over multiple days, because you can be a carrier of the virus and still test negative. So the county health guidelines specify when to isolate students, when to send them home, and when to allow them back. And we'll follow all of those guidelines. And none of those guidelines require testing for everyone. Related, if a student or a teacher tests positive, we'll follow the county health guidelines on sending them home and how long they need to stay home. Parent choice. The state budget was finalized on Monday. The county health guidelines were released yesterday. The details we need to move fast to implement. We want to maintain flexibility for families, but students coming to school and changing that decision on a daily basis is going to be very hard for our teachers, going to be very hard for the class, very hard for the individual student. So we are going to want families to make commitments on coming to school or not and keep it as stable as possible. It's not going to be 100% stable because the spread of the virus will change the circumstances, but we do want families to make a stable choice as much as they can. School hours, the plan for right now is to make them as close to normal as possible. So our regular bell schedules, our regular classroom environment, time-wise. What will be very different is things like recess and lunch. At the elementary level, students will not go to recess as a school or as a grade level. Breaks and outside activities will continue to be done in their groups. Going to get lunch will be done as a group, not as a school or a grade level. Same at secondary. There's going to be a lot of times at secondary where students have to move from classroom to classroom. They'll need to wear their face mask, but we're going to limit to as much as we can whole school activities. So we won't be doing rallies, we won't be doing assemblies. All of those large group interactions will be limited until the virus changes. There's a question about doctor's notes. The state is requiring attendance at school. San Jose Unified is going to offer in-person and online. If a student is not attending, we're going to need verification of why. If a student is attending online, we're going to work with the family on why that is. It will not require a doctor's note. If a student is attending in person, we're going to want that group to stay stable. If a student is not attending school in either way, we're going to need verification of why. So California wrote a new sentence in the education code for next school year that says compulsory education is not waived. So students are still expected to attend school with a teacher for 180 school days. If you're not attending, we're going to need verification for why. How will teachers support the students that are at home? It's going to be one of our biggest challenges. We're going to have to support our teachers. This has come up in conversations a lot. Many of the parents have shared with us their awesome tech skills. Some of our best teachers use less technology, but are fantastic at keeping a group of students working together and staying positive. Our teachers are going to have to learn new skills to transition that positive energy and that group focus to being online. I hope every parent on this call can understand how hard that's going to be. Teachers have developed strategies over the years to work with their classrooms. They're going to have to develop new strategies, and they don't have a lot of lead time. Instruction is going to be less than what we want. Nothing in our world is what we want. It's harder to shop. It's harder to eat out. Everything is harder right now. Our teachers are going to need a lot of patience and support because they're going to be doing their best to support students in class and at home. It's probably the biggest challenge we've asked teachers to face in their entire careers. Questions about the technology. We've already placed an order for 360-degree cameras for every classroom. They're scheduled to be here in time. So what will happen is each of our classrooms, it won't be a studio experience, but it will be a camera that rotates to the speaker automatically, has an enhanced audio system, and plugs directly into the broadcasting system for the class. So if we're using Webex, instead of the camera on my laptop, it's a camera that picks up the whole room with a 360-degree view and has an enhanced audio system, so the audio quality is better. Again, it's going to be less than perfect. These are not going to be studio quality classrooms with multiple camera angles and mics throughout the ceiling. Everything we do in the fall is going to be less than we want. And we're going to have to support each other and stay positive. Students with special education needs, we're going to have to provide all of the services in the individual education plans. We will work with families to adjust the IEP, if it's clear that some of the services can't be provided. So there are things that require mixing of groups in some IEPs. You know, students sometimes have a special education provider and then go to a general education environment. As those groups mix, we're gonna have to work with the family to limit that mixing because it compromises the stability of the group. There's a question about how we would limit class size if we had to. As of today, the county health guidelines do not put a restriction on group size. Stable group at elementary, face coverings at secondary. If that changes and county health says the new max group is this number, San Jose Unified would start restricting access based on existing parameters. So the state of California already has rules for prioritizing supports for students at risk or in need. Students with special education services are always prioritized. English language learners, low income, foster youth, and homeless students are also prioritized. Those are not rules that any individual school district writes. Those are in state law now. Those are known as the at-risk groups. We're required to provide them supplementary services. If we get to a place where we have to limit seats, we will start with the existing groups that have been identified as at risk academically previously. Since we don't know if there's going to be a limit or what that limit would be, we can't say today how many seats that would be. It will be, for our teachers, online teaching is going to be the biggest challenge they'll face. If we get a limit on class size, implementing that will be one of the biggest challenges our enrollment centers ever faced, because our groups are not static. They're not equally distributed. So the number of low-income students at school A is completely different than school B. If we get a number, we're going to have to go first to the existing metrics we've used for years on identifying high-needs populations. Then we'll have to go to other factors that are consistent with what society is doing in response to the virus. Are you an essential worker who cannot provide childcare? That would be a priority for the district to accommodate. All of those are factors we'll look at. Incredibly complicated. There's no right answer. There's no answer that will satisfy everyone. Our analysis of all the information is that county health is aware of that challenge. The state of California is aware of that challenge, which is why at this time they did not put a limit on the class size. We're trying to accommodate as many perspectives as possible. If county health puts no limit, we understand that some parents may want a limit on their own. We're going to try to provide instruction even if the family keeps their student home.
So this is Nancy Elbron again. As this information just came out, you're probably reading in the news or hearing, through social media and other different counties have different guidance. And in the Bay Area, we have a lot of counties. So you may be hearing a neighboring district in another county has different rules. We are obligated to follow the public health order and guidance in Santa Clara County. And so I would just encourage you to read and access that information. We'll have it available on our website as well if parents continue to have specific questions. But our county order is different than some of the other counties in the Bay Area. And I know that because I am in communication with large districts in the area, and they have different guidance. And that is, I think, a great question that we all had for public health. But given that the numbers vary by county, ours is based on Santa Clara County's data and the expertise of the individuals writing those recommendations for us. We are not health professionals, and so we, obviously have questions, but our job as public servants is to implement the guidance that we've been given by the health experts to the best of our ability.
So we have 6 of these meetings today. We did 2 staff meetings this morning, did a Spanish meeting. This is elementary, middle, and high. We want to make sure we keep them on schedule. So about 5 minutes left. We'll do a couple questions and then share the next steps. There's still a lot of questions about recess, play structures, lunch. None of the large group activities will exist in the fall until the health orders change. So students will go to class with their teacher and their classmates. They will need to stay in that group throughout the day. Lunch will not be in the cafeteria as a grade level. We will have to make all sorts of changes to make sure that the groups of students stay together. So this is our elementary call. There will not be in the fall recess on the yard with the whole grade level, or 2 grade levels or 3 grade levels. We still need students to take breaks. We still need them to be active. That will happen, though, as a class, not as a grade level or as a school. Assemblies will not happen. Eating in the cafeteria together, not happening. We need to keep the groups as tightly together as possible and not mix the groups. Enrollment, bell schedules, and assignment to a school will all stay. So we're not going to reassign students to different schools. We're not going to change their schedules. What you anticipated for the fall will, as much as our ability, stay the same. The differences are going to appear in, as I said before, the tightness and stability of the group. So we really do appreciate everyone's time. I want to emphasize before we go to the next steps, we have a full appreciation of how much you want to know more. We're working with you as fast as possible. The state budget was finalized on Monday. The county health guidelines were released yesterday. We scheduled these calls for today to get you as much information as we can. There's a lot of work we need to do to be ready for the fall. We're going to be working as fast as we can to get it done. It's not going to be normal. Nothing is going to be normal in the fall. It's going to be hard. It's going to be challenging. Want everyone to stay together and stay as positive as they can.
So next steps, we're going to be sending out another survey, and we really want to thank you for the great responses that we have been getting through the various surveys that we have sent out. This one will have more specific information that we need, especially from families that would like to keep their children at home and accessing their learning through distance learning. While you obviously, before the first day of school, have the opportunity to change your mind, it would be helpful to have that information now so that we can plan accordingly. So that survey will be coming shortly. We're also in the process of creating our own guide for families, much like the learning guide that we provided this spring. This one there'll be one around learning and one about all of these other procedural questions that we didn't have answers for today. You know, the cleaning protocols, the recess structures, the arrival, delivery, the lunchtime. We need to be as consistent as possible across our 41 schools and in all of the departments that we have at central office. We know that families have kids in various schools sometimes, especially, you know, the different levels that they have. And so to manage different rules by school site would be really chaotic. And so our commitment is to keeping our guidance and rules as consistent as possible from school to school. Obviously, the facilities are different, but for the general rules will be very similar. We're also going to continue as part of, you know, that design, our reopening plans, and communicating with you as soon as we have information, particularly new information on an ongoing basis. So, you know, I know that there's a lot of text messages and phone calls and emails coming, and it can be overwhelming. I know sometimes with my own kids' communication, it does become overwhelming, but we really are trying to get you as much as possible because we know that this information is important as you make decisions for what works best for your family. We're in the process of also designing additional supports and training for our staff, students, and parents. We know that there's a possibility that we will be in and out of distance learning given how this situation is playing out. And so we are going to emphasize professional development for our staff, both teachers and support staff, so that they continue to refine their skills with the applications and the systems that we have. We're also going to provide professional development and training for students and parents, especially parents that want to keep their children at home, that would like to be able to help their students get set up on the systems that we're going to be using. Those trainings will be designed and developed and recorded so that parents can access them when you have a moment rather than having to access that information live. You know, I want to give you our commitment. We have, you know, a little over 5 weeks before the opening of school, which is August 12th. That is the first day of school. We're going to be prepared, and we're really looking forward to welcoming back our students and our staff. We miss them dearly, and we know that working collaboratively, we can ensure a successful opening of school. It will look different, it will feel different, but I know that staying together and keeping our staff, our students, and our community safe, we will be able to someday get back to normal. So thank you so much for your time. Have a great day and a great long weekend.